Speech-language pathology is widely used to help treat, evaluate, and identify communication and swallowing disorders and delays in people of all ages. And while many people are aware of the job, they often do not fully understand the importance and impact it has on the clients and their families. One key area speech-language pathologists focus on are speech delays in children 1 to 2 years old. There are misconceptions that SLPs alone can correct speech delays, and this can be fixed by increasing awareness of the importance of parent-child out-of-session interaction and encouraging the parents to actively participate in their child's language development. SLPs are important, but they cannot do it alone. Parent-child interactions outside of sessions are essential for meaningful progress in the language development. Before understanding what the problem is and what the solution will be, let me explain what exactly speech delays are and how an SLP helps children that have speech delays. Speech delays are a common developmental issue that children face, and they are often told to seek professional help from an SLP. According to speech-language pathologist Julia Hartnett, speech-language pathologists, often called speech therapists, are educated in the study of human communication, its development, and its disorders. SLPs assess speech, language, cognitive communication, and oral, feeding, swallowing skills. This lets them identify a problem and the best way to treat it. Their goal is to help improve the child's language skills by recommending speech therapy to them.
Oh my God, did you open the door?
Yeah.
Do you know how to close them?
Okay.
Open the door?
Yeah.
Now, the problem at face has multiple factors towards it, and it can be solved through 2 different solutions. SLPs have limited time during each session and cannot make lasting changes without the support of the caregivers outside of the therapy session. So the lack of the caregivers following through at home limits the progress of their child's development. When interviewing speech-language pathologist Hayden Johnson, she brought up her experience with her clients' parents not looking at their child's portal when she documents all the work that they have been doing in the session. Here's what she had to say.
We also allow our parents to access their portal, which their portal is where I submit their insurance documentation. It is at any time they can look at my documentation and see what I wrote during the day. So they know what happened and they know what's coming. I don't think any of my current parents read any of that documentation, at least none that they have told me. However, it's there.
Yeah.
Sometimes you have to convince parents that, hey, it'd be very helpful if you went and checked that out.
It's hard for the SLP to help the child's development with once-a-week sessions, so the parents are important roles in the development because the SLP cannot be at home with the child every day. Now, the solution to this side of the problem would be to encourage consistent out-of-session practice and interaction and provide the simple tools for parents to add into daily routines. I conducted a survey with SLPs and received strategies they used and ways their clinics encourage parent involvement outside of the session. Speech-language therapist Haley Fletcher answered with this. We always provide methods for home carryover. If the parent is present during the therapy session, it is best to provide in-time coaching. This supports the caregiver's ability to observe language strategies used in the reality with their child. If the parent is not present during the session, we always provide outcomes of the session and home carryover strategies, as well as answer any questions caregivers may have. Parents sometimes do not fully understand the importance of their role as the caregiver. Some parents forget that they are with the child way more than the SLP and can lack understanding of how big of an impact they have in the language development of their child. In my interview with Johnson, she brought up a very important point, and this is what she said.
And then I always assign home programming, especially with 2-year-olds. If the parents aren't doing it consistently at home, therapy is worthless. And that is probably one of the hardest parts of this job, is convincing parents of how important homework is, because it interrupts their life, right?
This brings up the severity of how important the caregivers are in the process of development. Without the caregivers taking their time to help their child at home, going to therapy is not helpful because of the lack of practice at home after the session. The solution to this problem area would be to increase education and awareness about the role of parents in speech development. Supporting the parent with information and skills that help understand how to adjust their interactions with their child. In the survey, speech-language pathologist Jennifer Hopper replied with her strategies she uses in the SLP medical field to encourage parent involvement. Frequent family training, involvement in sessions as medically appropriate, early and ongoing education throughout the therapy continuum, ways to make speech therapy fun, engaging, and easy to incorporate into a hectic schedule. Hopper allows for multiple different strategies to be incorporated throughout the time working with the child to ensure that all areas of help are met with the caregiver's involvement, making sure caregivers get the helpful resources to best fit their child's needs will benefit not only them but everyone in the equation that is trying to help the child's development process. Now, what I'm about to show you is the difference between non-parent interaction versus parent interaction at home. Growth can stall when there is no support from the parents, either due to lack of time to sit with the child or not even realizing they are ignoring their chances to talk to them. But as you can see here, when the parents are engaged with the child at home, the growth can continue on from the therapy session. It is crucial that this knowledge reaches everyone to be equipped when finding out they know a child with a speech delay or have one themselves. Being aware of this problem helps those around to feel heard and seen and to seek help when they need it. Here's how parents can help, and anyone. Do everything with speech. It does not matter how small of a deal it is, talk it through with your child. The more the child hears, the more they are likely to mimic or try to say what you are saying. Here are just a few ways to incorporate daily talking into the family routines.
Clean up, everybody do their push, boom. Wash, wash, wash.
No.
What color shirt should she wear?
Go help pick out a shirt for her.
It takes a team, not just a therapist. The SLP is there to guide the family, but the parents are the child's daily teacher. Every interaction and word counts.
Ashes. Oh, we